Tracy, thank you for joining us kind of online. Jane, you're going to you gave us a teaser, a taster of this last time we kind of met. So this is the follow-up from it. So I wonder if you want to just kind of set some context, and then we can as a board look at plans from 3 of our mayoral combined authorities. And we've already touched on this morning the importance of that relationship moving forward. And this is a really good example of how the NHS and our partners can kind of work together on something that is a shared area of interest. It's been a theme all the way through today, so this is the right time to talk about it.
Yeah, thank you. Do you want to do any introductions before I?
Yes. Should we go around? Do you want to go around and do the table, round the table, and introduce people? And that will be really useful for you to know who we've got here. So we'll start with the room first of all, and then we'll come to the screen. Teresa.
Yeah. Hello everybody. I'm Teresa Connick. I'm the acting chief executive of the ICB.
I'm Desiree Brown. I'm the Director of Finance for the ICB.
Hi, I'm Johanna Brook. I'm Director of Communications at the ICB.
Stuart Watson, I'm a non-exec.
Bushra Ali, I'm a GP in Hull and I'm here as the primary care partner.
Nigel Wells, I'm the Medical Director and Executive for Clinical and Care Professional for the ICB.
Hi, Merlin Joseph, Director of Children's Services representing the DCS Group.
Hi, I'm Michelle Moran. I'm Chief Executive for Humber NHS Teaching Foundation Trust, but I'm also the provider, the partner and the mental health lead, mental health and disability neurodiversity collaborative.
My name's Andrew Hewitt. I'm Strategic Lead for Employability and Health at the Combined Authority, Hull and East Yorkshire Combined Authority that is. Currently seconded in from the East Riding of Yorkshire Council for a year to specifically work on this Get Britain Working Plan.
Thank you. Louise Welsh, Director of Public Health for North Yorkshire, but here on behalf of the public health community. Nice to see Tracy on the call, just to shout out to North Yorkshire and York.
Hi, I'm Simon Suckle. I'm a GP and Primary Care Network Director in Whitby and representing the Primary Care Collab. And we're part of the trailblazer for the North Yorkshire and York.
Yeah, great stuff.
Mark Chamberlain, non-exec director.
Sean Johns, acting Chief Operating Officer for the ICB.
Jane Anderson, acting Deputy Chief Executive and Director of.
You can insert that.
Yes.
Hello, I'm Amanda Stanford. I'm currently the Group Chief Nurse at Humber Health Partnership, but next week I'm coming to join the ICB.
Superb. And then I'm going to go to the screen and just the board members who are Andrew, and then we'll come to you, Tracy, and then I think that's a full house. So, Andrew.
Hello, Andrew Burnell. Now you see you're checking Jason Howell's still here. Now, Group Chief Exec of CHCP. Hello. How are you today?
That's really good. What's really good, Andrew, is that you're matching us for breaks, because clearly you're munching on a biscuit. Tracy.
Paul.
Tracy.
Hello everyone, thank you for inviting me today. I'm Tracy Watts. I'm Skills and Employability Manager at York and North Yorkshire Combined Authority.
Lovely. Okay, so Jane.
So it's lovely to have Andy and Tracy with us. We did also invite Claire Hughes from Greater Lincolnshire, but who couldn't actually make today. But you have got the presentation in the pack from Claire, so we can touch on that when we get to it. Just a little bit of scene setting. So at last month's board, I took you through how Great Britain Working fits into the landscape around health, work and skills. So to remind you of that, and if you want to look back on the presentation that I gave, feel free to do so. You'll know as part of our breakthrough work how important good work has been as a key determinant of good health in the work that we're doing. And certainly looking forward with the changes that we're facing as an ICB, we're still working on that health, work and skills agenda. Therefore, our partnership with our 3 mayoral combined authorities is so critical and important to us. And we're trying to work together and to tackle the challenges that we've got through this in a people-centred partnership, joined up way. So you've got a paper in the pack that just outlines those connections, but I think probably the most important thing is to hand over to Andy and Claire so you can talk us through. I'll probably start with you, Andy, because you're in the room.
Okay.
It's just a bit easier. And then I'll come to you, Tracy, after that. That's okay.
Okay.
Yeah. So just to remind people that the UK government have presented a clear proposal for reforming employment, health and skills within the country through the Get Bring Working White Paper. The two key aims of that really are to achieve an employment rate of 80% across all areas, which is very challenging for an area like Hull and East Yorkshire, and also increase earnings by allowing employees to get on and work. So what they've presented is a mandate for DWP, ICB and combined authorities to work together to develop a localised plan for their areas, laying out what their priorities are, really aiming at system change. So there's been a wide range of long-term work in terms of getting people into work, getting people the skills they require, the confidence they require, the kind of foundational elements they require in terms of housing and health as well. But obviously, what's different in this is the real mandate to work together jointly to be able to achieve that, which I think is really exciting and presents a whole range of really interesting opportunities. Alongside that mandate has been given a very tight timescale for delivery in terms of this first phase of this Get Bring Working Plan. I'm sure my colleague in North Yorkshire will join me in saying how much of a challenge it has to get something on the table within the timescales we've been given, especially within Hull and East Yorkshire, who was only set up as a mayoral combined authority on the 1st of May. I only came into role mid-July, and we had till mid-September to actually get something pulled together. So that has kind of framed a little bit how this document, in terms of the Hull and East Yorkshire approach to this, has looked. So what we've been able to do is working very closely with DWP and other partners to really understand what they wanted to see out of the first edition of this document. This is just a starter for 10 in terms of the conversation. So what it allows us to do is to lay out within the Hull and East Yorkshire document. There might be some slight differences within the York one, but I think the approach will be relatively consistent. But just try to kind of understand what the data is telling us in terms of what are the issues within our specific area. Then we've looked to do a clear kind of understanding of who's delivering employability support across the patch. So that kind of understanding of what's already out there, what's delivery, what the quality like, what the issues are with it. And there's a big issue in terms of funding with UK SPF, which is the kind of follow-on from European funding, which has funded a lot of this employability activity in the past, coming to an end at the end of this financial year, and what we do about that. And then within the context of the Hull and East Yorkshire document, what we've tried to do is outline some 3 top-level priorities, which allow us then to do some more work with all our partners over the coming months towards a second edition of the document, which will come back quite happily to present to you early in the new financial year. The reason we've had to do that is because one of the main kind of drivers for this is to reflect a lot of the strategic direction of the Hull and East, of the combined authorities. And because we are such a new combined authority, there's a whole range of economic documents that we're still pulling together and aren't able to fully reflect within the document at this point in time. So what the government have asked us to do is to produce a local growth plan, which really talks about what the sectoral opportunities within this region are in terms of driving that industrial strategy from government. Interestingly, Meditech is one of those sectors that we're looking at within the Hull and East Yorkshire economy, has been one of those ones that we can see some real opportunity to drive. That's a different story for a different day. I'm more than happy to come back and talk about that in due course, but that document has not been completed yet, and we're looking to complete that early in the new year. The other one is a skills and employment framework. So the way that ourselves at Hull and East Yorkshire Combined Authority have approached this is that this Get Bring Working Plan looks at the employability and health elements of it. The skills and employability bits are going to come out of the employability and skills framework, which again is working to a similar time frame in terms of delivery. So coming back to this document and what it tells us and what we need to do next. The first thing to say is a big thank you to the ICB. I understand that Andrew Barker was talking to you earlier on in this meeting. He's been really useful. We've been working very closely together in terms of developing a shared evidence base in terms of health and employability, which can help to inform this document, but also hopefully we can build on in the future to be able to inform joint commissioning in terms of some of this space. So say thank you very much for his support in developing this, and we'll continue to work with him and yourselves hopefully in the future in terms of doing that. But what that and the other data that we've been able to pull together alongside intelligence from a wide range of partners is a kind of story of this area, which probably, if you know this area, won't be unfamiliar to you. So we've got constrained labour market, we've got an ageing population, we have a fall of about 4% in terms of our working population by 2043. And what that means in economic terms is we're going to have to absolutely make the most of everybody we've got in the working population within this area. The driver of that kind of ties in quite closely with this, because we need to make sure that everybody who is available for work in this area, who wants to work in this area, is able to be supported into work in this area, and that's quite a nice like strapline for what we're looking to do here. So alongside that, we've obviously got an issue of long-term sick people being out of the workplace. The bald figures are pretty scary. 26,000 people in Hull and East Yorkshire area who are out of work due to sickness. In some areas, that's 21% of the available working age population on the coast, into those coastal areas. So we've got an issue around higher proportion of female economic inactivity compared to male, and again, traditionally we know that because of kind of caring for young people, but what we've found from the work we've been doing thus far is that kind of long-term sick population is having an impact of taking females who disproportionately have to undertake that caring role out of the workplace. And we think there's a lot of kind of skilled, capable people who we would like to bring back into the workplace by being able to support that kind of issue. We've got an issue of low levels of pay, providing a disincentive to entering the Hull and East Yorkshire labour market. So what we might find is that they might travel further to access better paid work if they feel like they've got the skills to be able to do that, or they just stay out of the labour market altogether, and both of those are suboptimal in terms of us. North Yorkshire might have slightly different issues in terms of that, but they might be pulling some of our skilled workforce into their area, for instance, but that's not a reason to fall out at this point in time. So we've got an issue around underutilised elements of the labour market as well. So we've found that care leavers are a particular issue, ex-offenders are a particular issue. So all of those kind of cohorts of people we want to kind of target to get them back into work. We've also got the overall long-term issue of graduate and young people out migration from the area, so people who've got a certain skill level move out of the area to get that kind of level of skills development that they want, and also graduates who've studied at Hull University tend to move outside of the area as well. We need to target that. Second element, we've got some skills and learning barriers, not least the steep trend increase in terms of NEETs, young people who aren't in education, training or employment. Low qualification levels in pockets of Hull and East Yorkshire, transport barriers in the East Riding, and the perennial problem of the complex skills and careers pathways. So if you're wanting to train to do a certain kind of job, where do you go to get the skills to be able to do that? Difficult sometimes for people who haven't got a lot of support to be able to get through that. And also, if you want to change your career, how do you go about doing that? It's probably even more difficult. So how do we break into that? Also, we found a range of business factors, predominantly a large amount of SMEs within this area, which means that they are less likely to be able to take people who are far away from the labour market. They want to take people who are already ready to work. So we need to get around some of that issue. And the region's sectoral mix has an over-representation of low-skilled jobs. So again, we're not going to deal with that entirely with this document, but hopefully with the local growth plan, we can start making a break into some of that sort of issues. And there's huge amounts of skills gaps and skills mismatches within this region in terms of, I was reading some statistics that were saying 45% of the jobs in the Humber area align with resident skills, which means 55% of the jobs which are available in this area, we don't have the right skills to be able to do, which is an absolutely shocking statistic. And again, that's something we need to target in terms of the work of the combined authority going forward. Finally, we've got some health and employability system factors which we need to deal with within Hull and East Yorkshire, so specific health issues such as mental disorders, musculoskeletal disorders, cardiovascular disorders and respiratory disorders. And I think those are what they are, but it's about how we can support people who are waiting for treatment with those to ensure that they can stay within the workplace whilst they're waiting maybe for treatment, if they have to wait for treatment, or while they're undertaking treatment as well. So what can we do in terms of that? Huge disability employment gap in Hull, so people who are disabled tend not to be working within the Hull area. Adversely, within the East Riding, we've got an issue where there's a large at-risk population where people are actually in work, and if we don't continue to support them, they're likely to fall out of the employment market, so that's something we need to deal with. And then finally, provision of kind of employment support, it tends to be uneven, and that comes back to the concept model of what we're trying to do within this document. So there's a wide range of different programmes funded by a wide range of different people with a whole range of different aims and objectives. And what we've found from our kind of research is that people drop into those programs, they get a bit of support. If they're lucky, they get a job, but more often than not, they bounce into another program, bounce into another program, bounce into another program, bounce into another program. So what we're trying to do is to develop some kind of hopper or a kind of funnel approach, so that we can have a range of different programs at different levels, meeting different needs, but somewhere where they can all be caught. And this is where one of the key elements within the government's approach comes within their Connect to Work programme, which is the main delivery mechanism that kind of goes behind this document alongside some of the skills work. And what we're trying to do within Hull and East Yorkshire area is to develop that funnel approach with a range of programmes who can continue to support people, but collect those people who are furthest from the labour market in that Connect to Work hopper at the bottom and provide them with meaningful support to get them into either of the programmes if they need it, but eventually back into the workplace itself. So that in a nutshell kind of tells the story of why we're doing it, what we're looking to do. In terms of next steps with this, we've got three kind of key objectives that we're looking to take forward within our document. First one's really around connecting support into work and health systems. So there's that kind of plumbing job which the government want us to do, which we've already started on. As I say, the data intelligence integration between the ICB and the combined authority is really good. We're looking to use that to help strategic alignment and commissioning going forward. There's a job around delivering the levers that we've been given by government to actually kind of help with this. So the Adult Skills Fund has been allocated to the combined authority to do that. And there's also for the area Connect to Work programme that currently sits with Hull City Council because it was kind of allocated before the mayor was up and running. So there's a bit of a kind of discussion about where best that sits in the long term. The likelihood is it'll be within the combined authority, but it's really important that we start delivering that. We've got about 3,500 outcomes to reach within the next 3 years, so we need to get on with that. And another thing that the mayor is really keen on is developing support for young people. So we're looking to develop a youth guarantee trailblazer for this area as well. And so that's something that's in our action plan in terms of next things to do. And then the third one, which is really quite an important one from my point of view, is supporting businesses to play their role within the Hull and East Yorkshire Get Britain Working, because it's all very well as well-intentioned kind of public sector people kind of saying, well, what can we help people into jobs? At the end of the day, if we haven't got employers who are willing to take those on, who haven't got the capability to take those on, don't feel they're supported to be able to take those on. So there's a range of actions within the document which you've probably seen around working in partnership to develop the Good Work Charter for the area, which I think had been started by the LEP in the past, and kind of pushing that down and seeing what we can do to be able to build on that. Working partnership, I know the ICB have done a lot of work in this place around healthy workplaces, and again working with you guys to be able to kind of see how we get some of those messages out to businesses. And then finally, develop an all-age careers pathway, which is about supporting not just young people into jobs, but anybody who wants to change their job or look for better, more affluent kind of opportunities within the economy. How do they go about doing that? What support is there out there? So we're still in the very early stages of this document. As I say, we'll come back with a second edition, which will really start to kind of put some meat on the bones of those objectives around, so what you're going to do, what money have you got to be able to spend on it. And so that's the next phase really, but at this point in time I just wanted to come and present to you what we have within the Hull and East Yorkshire Get Work.
That's really helpful. A much shorter presentation than the plan. Tracy, in terms of, and actually what's interesting with this is that each of the combined authorities is required to develop a plan.
Yeah.
But actually what's really interesting from the three that we have a copy of, these are from our three combined authorities, is the very different approaches they've taken to the same question. And I think that's exactly right, because actually there is something around that local ownership, around that local population and the needs of a specific area are exactly what it's about. So I do kind of think it's a different answer to the same question and at different stages in terms of people's thinking.
Yeah.
But actually, it's probably the most significant thing that I think we look at the moment in terms of that relationship between the NHS and our combined authority partners. So Tracy, over to you, however you want to do this.
Thank you, Woman. I do have a few slides, so I will share my screen. You'll be pleased to hear that mine is significantly shorter than our document as well. So I'll whiz through this quite quickly. Let me just share my screen.
Yours is beautifully green though.
Yes, we are very green. Is that? I'm just trying to make it full screen there.
Yeah, we can see that now.
Hang on, if I make it full screen, it should make it.
Just go to slideshow, I think. Yeah, there you are.
Yeah, is that better? Right.
Superb.
Okay. So I'm going to give you an overview of York and North Yorkshire's, the Get York and North Yorkshire Working Plan. I'm going to focus on the opportunities and the challenges, the process and the timeline. So in terms of, I thought I'd start with this slide because it's a really brief overview of our area, one we use kind of quite often. So we have a £28 billion economy and we're home to York, one of the highest performing cities in the UK outside of London. We do also have one of the most skilled and productive economies in the north. We are a huge area, one of the largest combined authority areas covering urban, rural and coastal communities. And we have 3 universities and a world-class science and innovation base. But beneath these headlines, there is another story to tell about our region. Our business base is primarily micro and small businesses, so 98% small and micros. This often means that there's limited in-house HR expertise and limited capacity for skills and training. We do have low unemployment, although like most areas, we are starting to see some changes here. We also have a strong qualification profile, but this does concede a dominance of low-skilled and low-paid industries. Generally, our wage levels are below national levels. We do have some pockets on the coast and in rural areas where that's particularly prevalent. We do have, similar to what I've said, constrained labour markets, so we've got increasing numbers of inactives, particularly relating to long-term sickness. We've got an ageing workforce. We've also got a decline in young people engaging in learning and work as well. Lots of our young people actually leave the area as well. We also have underutilised talent in our local labour market, so 36% of employers have underutilised staff and 2/3 of our employers report that they've got upskilling needs. So that's kind of a picture. There are some challenges in our area, but obviously there are opportunities as well. I'm not going to go into detail on this slide, but what I did want to show you with this is just in terms of the combined authorities, skills and employment activities and programmes. There's a wide range of activity out there. So we've got everything from, excuse me, the Skills Innovation Fund, which is part of our mayoral investment fund. This is very much aimed at building capacity and capability across our kind of provider base right across the area, particularly looking at how we can support that in terms of our adult skills provision as well. We have the work of the Careers Hub across the region. We also have DWP Connect to Work, it's already been mentioned, the supported employment programme for us that will go live in January 2026. We also have our Economic Inactivity Trailblazer, which has been 10 million for this financial year and up to another 10 million in the next financial year. And I'll touch on this in terms of the overarching plan as well. We have, as been mentioned, the UK Share Prosperity Fund, People and Skills, obviously ends in March though, so that is a bit of a cliff edge in terms of what's going to happen there. And then as of August of this year, we became the Commissioner for Adult Skills Fund and Free Courses for Jobs. So that's just shy of 11 million each year that's in our area that we can look to target and prioritise. And we also have the skills bootcamp provision as well. So there are some real, I think, priorities here, because like I said, this is just the combined authorities kind of activities around skills and employment. But there's some real priorities, I think, around simplifying the landscape, aligning, maximising kind of what we've got, but also an issue around coordination, particularly in relation to employers. All of these initiatives and different schemes require a huge amount of investment and time from employers. So we need to think about that employer engagement piece. And that again is set against the backdrop of increasing costs for employers. So if we're going to have those kind of lasting impacts, employers are really vital to that picture. And then at the bottom of the slide is the actual plan. And obviously this is a real opportunity to bring together different plans and strategies, programmes, and look at how we address some of those challenges and how we can maximise those opportunities as well. So in terms of the actual plan, our aim is around enabling more people in York and North Yorkshire to enter, remain and progress in good quality and secure work that supports healthy and thriving communities and businesses. So that's kind of the overarching aim of our plan. In terms of how we're kind of aiming to do this, there are a number of priority actions that we outline in the plan, and they fall into 3 priority areas. Now these are aligned very much to our Trailblazer priorities, but also aligned to our local growth plan as well. So the three priority areas are supporting pathways, local people, enabling good work, and strategic alignment and collaboration. So in terms of the supported pathways, we're looking to develop and deliver provision that is led by the data and the evidence. And again, you've heard that already this morning, but there's a real need to have that robust evidence base. Also the importance of person-centred, holistic and place-based support. So I think there's some real opportunities for us to further develop some of the work that started, particularly through Trailblazer, around neighbourhood and co-located work and health support. So some of that work is happening through our GP surgeries and through the establishment of MSK hubs, through leisure centres and through mental health hubs as well. We also want to align and utilise the divorce skills funding and employment support. That includes connected work, so we can ensure we've got those clear pipelines and pathways for individuals. And again, it's linked to those growth sectors in the local economy as well. And then we also wanted to develop an all-age approach to career support. So this is making sure people have the right information at the right time in the right place, whatever stage of their career or working life they're at. In terms of the work with employers, this is all about recognising, as I said, how important employer engagement and commitment is to people being able to enter and progress within the labour market. So we do want to develop that employer engagement and coordination strategy. We want to simplify the work health and skills landscape for employers. It's a very complex landscape, and employers really want to get on with the business of doing their work and growing their businesses, and it's very complex in terms of work health and skills. We also want to support the work of the York and North Yorkshire Combined Authorities Community Wealth Building Commission. So this has been recently established. It's grown very much out of the work we've been doing through the UK Share Prosperity Fund, but it also ties into what we're doing around Trailblazer, around a community wealth building approach to good work. So we're looking at things there around anchor institutions and good work pledges and charters. And then the final one under this is around supporting and promoting self-employment as a route to becoming and remaining economically active. And the final priority is strategic alignment and collaboration. So this is about providing that system leadership through the development of shared governance model. Now this is something we're funding through Trailblazer activity to actually research into what that shared governance model can look like. We're really keen to build on what's already out there. There are so many different groups, and we tend to find the same people that sit on those groups wearing different hats. So we're really keen to look at how we can take that forward in terms of a shared governance model. We're also prioritising system coordination, accessibility and navigation, so basically making it easy for people to get the support they need. This has been spearheaded through the development of our work and skills interchange. This is funded through Trailblazer, and we're looking to provide that coordinated point of access for support around work, health and skills, whether that's for an individual, for a business or for a provider. The next one's around the importance of the integration of data intelligence and research, so that we can better understand the issues but also look to develop interventions on the back of that. Again, we're funding some of this work through Trailblazer, and we're working closely with yourselves on how we integrate the research and data, and we're keen to strengthen that and develop it further in year 2 of Trailblazer as well. We do want to explore the development of strategic frameworks as tools to help us move things forward. So in particular, through the plan, we're going to look at a behaviour and systems change approach. So in order to get that systems and individual change, we're also looking at a strategic commissioning model with a shared outcomes framework. And the hope is here that this will help with the design and delivery of programmes across work health and skills and help with that kind of joining up agenda. And then the last two are more generic ones about strengthening strategic alignment across local, regional and national plans and strategies, and then also how we just build that capacity and capability right across the system. So they're the priority actions that we're looking to take in terms of the process and timeline. The guidance states that the plan needs to be approved by the Combined Authority and strategic partners before publication. So our plan's been built very much on some of the early consultation work we undertook as a result of the Economic Inactivity Trailblazer, but it has been co-designed by our steering group. Now, we set up the York and North Yorkshire Working Steering Group in June of this year. It has ourselves, our 2 local authorities, North Yorkshire, City of York, ICB and DWP that sit on that steering group. As I've already mentioned, we're going to do the research that will look into that shared governance model, and that will help to take all of this forward. We've also asked for letters of support from our two local authorities, DWP and ICB, prior to the publication of the plan, which will happen this month. And then this is very much the first edition of the plan, a more detailed delivery plan we're aiming to produce by March, and then to review the plan in June of 2026. And the final thing to mention is that we do have an event planned for the 4th of December to launch the plan, and we'll also look at how we can provide some updates there around Trailblazer and Connect to Work and what's happening and how we're linking all of that work together. So that was a bit of a hop, skip and a jump really through our plan and kind of the timeline for it.
Lovely. Thank you. Thank you, Tracy. Well done. So we also have a copy, just for completeness, in terms of the Greater Lincolnshire plan, which is their take on the same kind of questions. And I guess, Jane, the plans are here because it's clear there's a real alignment, I think, between the ICB, and the ICB is clearly a key partner in delivering these. So there is something around the ICB receiving these, having the opportunity to see the plans at a very early stage. And I kind of think the most interesting thing about this is about the plan just kind of sets out some intent, but actually it's the detail bit that follows subsequently, which is the bit I think I'd like to come back to the board to become much more engaged in the what we do rather than the reason for doing it, because I think in each of them there is a compelling case that says why wouldn't we do this. And actually some of this very much in New World for me is about the opportunity we have to work as a partner to deliver something, because we, you know, I fundamentally believe that good work is the key to tackling health inequalities. And actually, if we focus on good work, actually we tackle not only improvements to people's health, but actually we start to kind of really develop kind of skills. So there is something around this just being a staging post with the ICB. So there's some interest in the room. So I'm going to take Stuart and then Michelle, and then Anya. So Anya, the last minute. Come in, thanks. Stuart.
Thanks very much. Thank you both for your presentations. I wonder if I could encourage you to look at the working age and compare it to the state retirement age, because I'm mystified as to why you would stop at the age of 64. That's obviously interesting from an NHS point of view, because people as they get that bit older possibly become a bit frailer, so you might need a different kind of support for that last 5 years or so. I